in marriage. Great, recording in progress. Tanf, right now, United Way of Greater Chattanooga has a Tanf grant that we are working in partnership with the Partnership for Families, Children, and Adults and Helen Ross McNabb that is specific to building stable lives. And so we've had some opportunity to work inside the specific legislation, empowering families to frankly, become economically self-sufficient. With a specific focus on multi-generational approaches to also empower children. So what we're here to talk about today is an incredible opportunity, the Tennessee Opportunity Pilot Program, which is purposed to keep children living with their parents while adults find work, education, and other skills to be empowered to climb out of poverty. Now, what's really exciting is that $182 million from the Department of Human Services existing surplus reserve is going to be supporting the planning, implementation, and evaluation of 3-year grants across the state of Tennessee in 6 communities and 1 pilot program to be administered by the Department of Human Services. So essentially, what that means is planning grants, which is an incredibly wise thing to do for a program of this size, that then would lead to implementation grants, 6 across 6 communities across Tennessee. What we know so far is that 5 million, or about 50 organizations, would receive planning grants to go through a rigorous application process for pilot program funds. Those planning grants would be awarded by October the 1st. Those planning grants could be up to $500,000. And then through that planning process that would be incredibly rigorous, implementation grants would be awarded by May the 1st. Each grant award could be up to $25 million. So as you can see, these are tremendous investments in our communities across our state to bring innovative, rigorously evaluated opportunities to help empower families. The key from what we know is scale, impact, and that at the end of a 3-year period, we could have opportunities to take an effort and scale it across the state of Tennessee and really see an investment that changes the lives and the trajectories of all Tennesseans. So big opportunity. That's why we're having this conversation today. And United Way is pulling it together because frankly, that's our mission. We are here to unite people and resources to build stronger, healthier communities. And I can't think of a better way than to be having this conversation today about people, ideas, data, innovation, frontline people who know the work on the ground, and then folks like Senator Watson who helped create this incredible opportunity. So let's get to it. Let's unite people and resources in figuring out how to build stronger, healthier communities. Senator Watson, you don't need a lot of introduction because frankly, you are often representing a whole lot of us on this call. You're our state senator for District 11, the chair of the Finance, Ways and Means Committee, and we all worked with you very closely in the fall administering the CARES Act and working closely with DHS. And so now we get the opportunity to continue that in this TANF work. So welcome and thanks for being with us. And thank you for those of you who don't know Jamie Bergman with the United Way staff. Jamie closely follows policy and legislation and works with our advocacy work here with United Way. And she's going to be fielding and asking questions alongside Abby and myself today. So welcome, Bo.
Well, thanks for having me. Can you hear me okay? Good.
Yes.
Okay.
Yes,
I have here with me also Lainey Phillips, who basically runs the office here in Nashville for the Finance Committee. So when I say something that's either inaccurate or just plain stupid, she'll send me, slide me a note over. But Leslie, you pretty much covered the legislation pretty thoroughly. Not a lot technically to add. I think the rationale for it, you have recognized, which is, we need to think big and think bold. And so working with the Department of Human Services and my colleague, David Hawk in the House, we began this exercise about 2 years ago. Now, I'm a big whiteboard person, so if I have to get up from my seat and draw something on my whiteboard back here, I hope that's okay with everybody.
We love that too. Go for it.
Okay, well, I'm gonna read it, recite it, and memorize it. So if you'll remember, about 2 years ago, the Beacon Center here in Nashville did an article about the state of Tennessee's Tanf reserve is what it's been called. It's not really reserve, but the state of Tennessee had about over $700 million of TANF capacity that was not being utilized. That led to the creation of a TANF work group, which was chaired by Representative Brian Terry in the House. I was a member on that work group, as was Representative Hawk, and our charge was to look at that amount of that money that was in reserve and figure out, is there a way to utilize it efficiently and effectively across the state? We had 2 or 3 hearings, and then the pandemic hit, and it sort of slowed us down, obviously, as it did many different operations around the state. And Representative Hawk and I, along with some other nonprofit folks, continued to sort of pound the rock, as my dad would say, on trying to figure out what we would do with this capital, this amount of money that we had for the state. And then the folks Tennesseans for Early Quality Education have been really engaged in this process of how we use the money. And the legislation that's before you is really a byproduct of that work. Representative Hawk and I were the sponsors, but obviously there are a lot of people, particularly the Department of Human Services and the nonprofit community, that helped contribute to the creation of it. The 2 big things that for me that were really critical was, number 1, establishing reserve. So let me stand up here real quick. Your folks probably all know this, but just in case they don't, the state of Tennessee gets about $191 million every year in TANF funding. So whether we spend it all or not, we get this allocation. Historically, we spend about 71 million. So you've got the difference, the delta between the 191 and the 71, and that's gone on for a long period of time. And that delta, that difference, is what was making up the reserve that was referenced, which eventually got up to greater than $700 million. Okay. Now, some of that money, this gets a little bit confusing for some folks, but some of that money is already obligated and spoken for, because, as you know better than I do, oftentimes grants that go out are on 3 or 5 year cycles. And so you have to have the money obligated for the 3 to 5 years. So after some lengthy discussion, we kind of decided on the amount of money that we thought we had was somewhere north of 300 million. And we started building our strategy based on that 300 million. I wanted to be sure that we always had a year's worth of funding available in the event that we had some kind of catastrophic economic event like we had with the pandemic. So we take $191 million in the legislation, in the law now, and we stick that into a reserve account so that no matter what, we always have a year's worth of funding for our TANF program. Okay, so hypothetical, let's say in a year that we spend the normal 71 million, we wouldn't touch the reserve. But let's say there was a year where we had to spend 200 million because of economic conditions. Okay, so we spent 200 million. That means we would have to draw 9 million from the reserve. Okay, 191 plus 9 equals 200 million. The next year, before we can spend any money in the program, we've got to replenish the 9 million or whatever that difference is, so that we always keep a running total of $191 million in our reserve account. So we always ensure folks who rely on TANF, organizations that use TANF, we always ensure we've got that year's funding. So that was the first critical component for me as a member of the work group. The second critical component was to how do we create a way to get the nonprofit to community to stretch their creativity and their innovation and create a program that would really come up with some really big ideas. Big, hairy, audacious goals is often used in the business world when you talk about doing something like that. And what we came up with is we're going to do 2 grants, big grants, the opportunity grants in each of the 3 grant divisions. So 2 times 3 is 6. And then we're going to give DHS the opportunity to do 1 grant of their choosing. And we're going to fund these over 3 years up to $25 million. So we really wanted to push the nonprofit community to think about new ways of doing things and provide resources to measure that. The most important part of that was to ensure that we do an academic study, a randomized controlled trial, RCT, which is, of course, for most programs like this, the gold standard. We wanted to be sure that that was part of the big grant program. So every big grant will be also going through a randomized controlled trial so we can see if what we think we're doing is actually what we are doing. Well, in order to get to these big ideas, we put in place some planning grants, which allow for nonprofits to exercise their creativity and have the resources to exercise their creativity and come up with some ideas that they might sell to a larger group. Finally, there is an advisory board that's created by the legislation, and their responsibility is to select, not only have oversight over Tanf, but to select the 6 grant recipients over the 3 grant divisions and to monitor their progress. I'll stop there, Jamie and Leslie, and see if anybody has any questions. Was that too much?
No, that was great. That was great.
I get kind of fired up about this because this isn't something that government normally does, right? I mean, government, normally doesn't really measure the effectiveness of its programs, or where it does measure the effectiveness of its programs, it typically measures in outcomes like, how many people signed up for this or how many people got that. And it never really measures, is it having the effect that we expected it to have. Now, I know the United Way several years ago sort of pivoted to where they're using that same kind of metric to where they say, hey, look, this may be a great idea, but does it do what you think it does? And we're not going to fund things that are nice and they feel good and the community likes them, but they really don't help people the way we think they should be helping people. And that's where we're trying to get government to act a little bit different in this circumstance.
No, that's fascinating. I loved having you explain all that. Actually, on the whiteboard, I think was really helpful. So to clarify, just because we have a question in the chat, the TANF dollars come from the federal government, right? Is that true?
That's correct.
Okay,
Mm-hmm.
So it's federal allocations to the states, and we've just accumulated this unspent amount.
Well, so the way the grants work, the way TANF money works is they don't give you a check for $191 million. Okay. You draw that money down as you need it. So it's not really a true reserve in the sense that you've taken money and put it in the bank. The correct terminology would be capacity. You have the capacity to draw down $191 million. Historically, we draw down, 70, 80, 90 million of that $191 million.
Okay, great. Thank you for that clarification. So I'm going to take us back to some of the details of the components of what's being proposed. So I know we said it, but we're already getting questions in the Q&A about some of the details. So can you tell us about just some of the key pieces of the pie here, of like there's an advisory board, the planning grant, how many planning grant goes to then execution grants, and just to give us a little bit more detail, if you would, please, Senator.
Right. So I think if you look in the legislation, there are some dates that are laid out that by this date and that date, certain things will happen. I'm going to be more general on that because I don't have legislation sitting in front of me. I probably should, but I don't. So
help you.
we're putting together, oh, wait a minute. Here, see, here's Lainey. She's already handed me my Tanf.
Oh, there you go.
I wanted to impress y'all and do it all from memory, but obviously I'm not going to be able to do that. So there's sort of some milestones along the way. The first milestone is we're in the process of developing now, which is putting together the advisory board, which has sort of dual responsibility. One responsibility is the normal advisory of TANF functions that the board has always had. And the second is that it is this advisory board that the ideas for the big opportunity grants will be presented. Now, my vision for how that would go would be somewhat like you might see in a venture capital proposal, or you might see on Shark Tank, where an organization comes in and they make a physical presentation to the advisory board on their program, their plan, and what they expect the metrics to be and how they expect it to be successful and work. So that will happen over the next year. During that time, we're going to be providing the planning grants, which will allow agencies or entities to start thinking through and financing some creative thinking time for what their project might look like. I'm going to give this to Lainey, and she can maybe look and see if there are specific dates, and I'll come back to that so I can
So the
give you
planning
the
grant.
milestone.
Oh, I'm sorry. Excuse me.
That's right.
But planning grants, there's going to be up to 50 of them awarded statewide
Mhm.
we believe that's coming this October. Is that
That's
right?
correct. By this fall, the goal is to have that money out and in people's hands by the fall.
And then you're intended to use those dollars to make the investments you need to properly plan and put together what would then be your pitch that you take back to the advisory board this coming next spring, basically.
Correct. Okay. So what we don't want to happen is us to give you $5 million to keep doing the same things that you've been doing, right? Now, some of those same things that people do may be very good and may be very effective, but in the business world, you get caught in the whirlwind and you don't take time to plan or think through things because you're in the day-to-day whirlwind of operations. This is to try and help you step outside the whirlwind and think, hey, if we had the resources to do X, what could that be? And so this $5 million is for that purpose. These are the resources to help you think about what that X might be. And then create it in a fashion that you think, you know what, we think this is such a good idea that we're willing to compete with other ideas to see which one's the better idea. Now, obviously, the more collaborative, the more regional, the more results-based that the idea is, the better it's going to look, I think, to any advisor who's sitting on the advisory committee, because again, at the end of the day, the idea is to come up with something that actually works and then is scalable, so that if something works in Hamilton County and it goes through the 3-year evaluation and the randomized controlled trial says, hey, actually, this is actually doing what you thought it would do. Our hope is that then we would say to the next kind of grant, this is what we want you to do. So we say to Nashville, hey, you had a good idea. It didn't work, but the Chattanooga or the Hamilton County one did. Here's what we want you to do. Not only do we want it to be scalable across the state of Tennessee, but we think that Tennessee has a chance to be a real leader across the country, because we're not unique to these kind of challenges, where other states who we communicate with each other often would look and say, you know what, they've got this, they're doing this in Tennessee now, and they've proven that it works. Why are we, let's not reinvent the wheel. Let's get with the people from Tennessee and see how we could execute this same kind of strategy across our state. So there is not only an efficiency and effectiveness for Tennessee, there is also an efficiency and effectiveness goal for the use of all TANF funds, because every state is eligible for them. So I think it gives us an opportunity to be a national leader, and particularly, I'll admit I'm a home team player, and I would love to see something that developed out of Hamilton County or the southeast corner of Tennessee be something that folks in Idaho, Washington, Missouri, Minnesota, other states are saying, hey, this actually works.
Well, that's a good segue then. So can you tell us a little bit more about the Grand regions and how you all anticipate this funding being dispersed across the state?
So in order to make the legislation work, equitable distribution of state resources is really important. So we selected, we used the 3 grand divisions as the boundaries for 2 grants in West Tennessee, 2 grants in Middle Tennessee, and 2 grants, big grants, in East Tennessee. How those are distributed will be part of the advisory board's responsibility in looking at the grantee or the grant proposal. If someone does a grant proposal that affects 10 people, it's probably not going to have the same impact as a collaborative effort that has regional application across a part of the Grand Division would have. But, it's conceivable that, Knoxville and Chattanooga have 2 great plans and those are selected. It's conceivable that Chattanooga had 2 great plans and those 2 are selected. Obviously, politically, you want to make sure that you're spreading the resources out all across the state. Before we get, and I love the research component, but there's something that I want to make sure that I don't forget to say, and I'm going to go back to my board. So, I told you, hang on a second, I'm probably not the poster child for a good elected person, but this is how I work. Anyway.
Oh gosh, we love whiteboards, please.
So I told you that we get $191 million every year, right? We get that capacity. So here's something that's really, really cool and really important, particularly to what we believe were some of our underserved areas. Once the state has spent its allocation, so I'm going to just use easy math. Let's say the state has $100 million in Tanf programs that it's funding, okay? So it spends that 100 million and it's left with 91 million. The law requires, as long as I've got my $191 million reserve, okay, you with me?
Mhm.
Okay, as long as I've got my $191 million reserve, okay, fully funded, the law requires all of that 91 million to be spent. So now for your agencies that are listening, you have to be careful of that because that's really one-time money. Because the next year, let's say this is 110 million. Okay, well now you're only going to be spending 81 million. Okay, you follow me? Okay. The point is that if the feds are going to give us $191 million, then let's effectively and efficiently use it. Let's not waste it.
Right.
Let's use it effectively and efficiently, but let's use it as long as we're maintaining a safe balance. Now, there may come a time in the future where we say, hey, this needs to be 200 million or whatever. As long as it's got a year's worth of funding, we should spend it all the way down effectively and efficiently. And one of the goals of the developing these grant ideas is that helps us establish effective and efficient use of taxpayer dollars, because the public is willing to fund things that gets the desired effect. They are not willing to just throw money at a problem. And so the whole strategy behind this is to get away from throwing money at a problem and instead creating actual solutions to the problem and then coming up with a way to fund those over time.
Yeah, that makes a ton of sense. Okay, so there's lots of questions coming in the Q&A, which I'm going to try to sift through them. Patrick has also shared in the chat a link through to the actual bill, it looks like, that some of y'all were asking for. One question that seems to be coming up is, do we still have regular TANF dollars, right?
Yes. So that's the let me see if I can, there we go. The 191 million, okay? And then we continue to get that. So we've got where the 191 million reserve, we're going to build that. And then we're always going to draw down this 191 million. So yeah, whatever's being funded today will continue to be funded. Now, what I would say is, as this process matures, we will start looking perhaps more rigorously at some of the things that we've been funding with TANF dollars and start asking more challenging questions of, is this really getting the result that you want it to get? But things like SNAP, those kind of things that we fund, those things will continue to be funding. There's no change in that kind of funding.
Okay, great. Thank you for clarifying that. And then, again, this might be a little bit in the weeds, but just kind of clarification. What types of organizations are eligible to apply? Is it just nonprofits, or is it?
No, we tried from my position is we need to hear from every Tennessean who has a organization that has an idea that might be practical and might be pragmatic and might be operational. So we've tried not to limit it to whom or who could participate.
But you are looking for collaborative efforts that are more.
Well, that makes them. I mean, I think that makes the most sense because, TANF dollars cover an array of life circumstances. And I think the more collaborative that you are, it will not only foster the better ideas, but it also tends to regionalize a little bit more. So yeah, I think, again, it will be up to the advisory committee to decide which pitches they want to support, which of the 6 they want to support. But I think it gives strength the more collaborative you are.
Yeah.
Hey, Abby.
Yes.
I can tell you that in the legislation summary, to get really specific, eligible entities that can apply are a political subdivision in Tennessee, so counties, cities, or special district like school districts, a nonprofit corporation, a development district, or human resource agencies are all eligible to apply.
Okay.
Who'd we leave out? I
don't know.
Okay, and then understandably, I think we got a lot of Southeast Tennesseans on this call. Really curious. I know we've talked about the grand divisions, but just to kind of go back to that a little bit, do you anticipate that the 50 planning grants and then the 6 that are not going to DHS final grants, will those be evenly distributed throughout the state, or is that where the grand division piece comes in?
So the 50, the 5 million each, that's more in the purview of DHS because they have the most knowledge about all the different, because potentially you could have someone apply who has no plan for being able to, there's no way they could do anything bigger, right? So we leave to DHS to sort of filter through the 50. The 6, there will be 2 in the West, there will be 2 in the middle, and there will be 2 in the East. Now, whether they're in the Northeast or the Middle East or the Southeast will be up to the quality of the grant, of the presentation, and what the advisory committee chooses.
Okay, that makes a lot of sense. Okay, so now asking about the evaluation of the programs, because we've heard you say, very methodical third-party eval. Are y'all anticipating that, and again, you might not know this level of detail yet, but would that component be baked into the actual application, meaning it's part of your budget that you submit, or do you anticipate DHS hiring a third-party evaluator, like a university or something like that, that would evaluate?
Yeah. So number one, I'm not interested in the entity studying themselves and telling me what great work they're doing, because why would they tell me otherwise, right? I don't think DHS is that's in their wheelhouse of what they do. So my vision is that this is a third party entity that's independent, because I want someone who can come in and say, hey, look, I know you think you're doing a great job, but we're halfway through this process and it is not getting any of the impact that you thought it was having. So we're not going to continue to fund this, or you need to pivot, and here's what you need to be doing, because this is just not getting the results. And now you've only got 1.5 years to prove to this group that their project actually will work. So I need it to be, or I want it to be, someone who is independent, who doesn't have political pressure on them to give us an answer that we want to hear, but rather gives us the answer that we need to hear.
Yeah, that makes a ton of sense. Sounds kind of like our new process at United Way, actually.
Well, and as I'm sure Leslie and Jamie know, that, people say they want to hear the truth until you tell them the truth, and then they're not quite so interested in it. But I think, again, part of this is to instill public confidence in what we are doing. Again, I believe, we are not only is the state benevolent, but, we're the most benevolent country on the planet. And people are more than willing to pay for stuff that they know gets the result for what they're paying for. We just haven't done a good job about proving to the public that certain kinds of projects work. And so that's why a heavy dose of academic rigor using a randomized controlled trial is a real essential part of the legislation for me.
Yes, we agree. I think that's really critical. Okay, so a little bit more about the advisory board, then I'm going to punt it over to Jamie. Mm-hmm. People seem curious as far as how the advisory board is going to get selected and the kind of distribution of responsibilities between the advisory board and DHS administration. Could you give us a little bit more color on that?
Right. So there are 21 people that sit on the advisory board. Some of these people are there by virtue of their position. One of the things that we were adamant about was that the commissioner of the Department of Human Services, and not his or her designee, but the commissioner is the chairman of it, because they have the most working knowledge. But we wanted to put a lot of, quite frankly, responsibility on the chairman, the commissioner, to make sure that this was carried out. So we named the commissioner as the chair of the board. Now, the others, the labor and economic community development, education, health, those are all areas that Tanf has impact on in one way or the other. So we put the commissioner or his or her designee on the advisory committee, because we think it's important that from an executive branch function that the advisory board is able to get feedback from people who actually understand how this money kind of works in their space. And then 2 members are nominated or appointed by the Speaker of the Senate, so that we have legislative interest from the Senate, and 2 members from the House, so that we have legislative interest from the House. Because at the end of the day, there arise situations where you need to have political understanding of how the process may plan out. And then 3 representatives from the business community, 3 representatives from the nonprofits. Those are selected. I think that the objective there, the way that's done is both through the 2 speakers of the House, that you and your organizations will suggest people to the speakers, and that's how those people will get appointed on there. And then 6 of the members are appointed by the Commissioner of Human Services, because again, they have been in this space since its beginning, and though they know who the players are, who the good players are, or who the not so good players are, and we want to make sure that they make the best selection.
Makes sense. We've already got people who said that they're checking the website frantically and are curious. Do you have any insight for when they're going to release the actual application or details or anything like that?
Well, remember, the budget doesn't go into effect until July 1 of 2021. So we're still putting the pieces together. DHS, I will have to ask them about where they are on their timeline, but they've done yeoman's work. They've got people like me yelling at them about this process, and then I hang up that phone and then pick up another phone and call them and yell at them about the CARES Act or something like that. They've got a lot on their plate, but I anticipate this is really important to them. It's really important to the commissioner, and so I would think that information will be forthcoming relatively soon. But I'll have to check with the department, see where they are in that process.
Okay, fair enough. Jamie, I'm going to let you close this out.
I will say, Abby, that as she always does, Lainey has highlighted a bunch of these dates for me. So Probably the important one is that by September 1st of 2021, the commissioner will call the first meeting of the advisory board, which is really where, in terms of the big grants, the clock starts ticking. And then the other grants have to be on their way out. So I would think that DHS will be working very frantically and quickly on these over the summer to make sure that the information is available for grantees.
Thank you so much. We really appreciate you coming. I do have a couple of questions. I wanted to dig a little bit deeper with you. And I know you and I have had some discussions on this, and I thought it was important for this group to hear. When we talk evaluation, you're not talking surveys. You're not talking the typical type evaluation. You're looking at a study.
No,
and I know
right.
you've done some research into that and different ways that people and different programs have done randomized trials and how those are very different. Can you speak a little bit more to that and to why this is so important in this process versus what you typically see in an evaluation?
So first of all, I'm not interested in any kind of survey monkey. All right. So those don't count. These are, and again, this is why an independent third party is important, because we need to have people who are willing to tell us it's not doing what you thought it was going to do. It's not working. Many of you maybe on this call have heard me. I guess I'd say my inspiration for this was really a podcast that I listened to, and I would encourage you folks to listen to it. It's called Trade-Offs. It's an economic podcast, but I guess it was from January of last year. There was a program on Trade-Offs called Hotspotters, and it was about a guy named Jeffrey Brenner who had started this health program, which he won all these international awards for this health program. But healthcare economists, when he would speak at these various conventions, they were like, yeah, he's saying all this stuff, but how does he really know? You know, he's never really looked at it. So he subjected, after winning all these awards, he subjected his program to a randomized controlled trial that was performed by, I think it was a healthcare economist out of MIT. At the end of the day, they discovered that while the program did some really good stuff, it did not do what they thought it did. And after winning all these awards for what people thought was a great thing, they realized that it didn't really have any kind of impact at all. And I thought, you know, we do that a lot in government, and we ought to be willing to subject what we do, programs that we do, subject them to academic rigor. And where they don't work, just be honest and say, you know, it did some good stuff. It just didn't do what we thought it was going to do. And we're going to kind of reposition ourselves and try another thing. You know, if you're in the business world, or if you're in the startup world or the investment world, you recognize that you're going to invest in 100 deals to try and find one, right? And the ratio may be even higher. You're going to invest in 1,000 deals to try and find one. And so my hope is that, and what I realized from that podcast is that, one, we don't subject ourselves to academic rigor. And number two, we don't accept the fact very well that when something isn't working, it's okay to say, this isn't working. Let's use our resources another way. There are a lot of reasons for that, but this is an attempt to try and break us from that kind of habit. So I encourage your folks who are on there, if they want to hear a really good one about randomized controlled trials, Hotspotters on Trade-Offs, January 2020, I think it's about that range. It's a really good discussion. Jeffrey Brenner, I've actually emailed with him to try and figure out, hey, you know, you might be able to offer us some insight into what we're doing here in Tennessee.
Mhm.
Thank you. And we do have that information that we can send out to everybody, all of the blog, as well as some of the other research points. I think they're very, very interesting and would tell you a lot about what the expectations are. And then you are saying that it's important to recognize early that if things aren't working, you have a chance to correct that, you know, just because they're 3-year grants doesn't mean you can't change, look at something a little differently, and possibly pivot in what you're doing. Is that what you're?
Sure. I mean, and I will leave it to the researchers to determine, you know, what type of timeline they lead to have, you know, reliable and valid data. But I would hope that if not semi-annually or annually, there is a honest sit down with the various programs. There are only 6 of them, and sit down and say, look, the initial results just don't seem to show that you're getting any kind of benefit, but it is telling us that you need to be doing A or B. So how can you pivot to do A or B and see if we can change your results? I would assume if you got 2 years into something and it was having no effect whatsoever, that the advisory board would say, yeah, we're not going to continue to spend money on this if it's not going to have the effect. Again, we recognize, or we should be willing to recognize that if we can get 1 out of these 7, because there are 7 altogether, if we can get 1 out of these 7 to really hit a home run and become scalable, that's probably pretty good. That's probably a pretty good ratio. From your own experience that the biggest problem is you can have any kind of thing that'll work with 10 people. It's when you try to scale it up that it kind of starts to come unglued. And so that's why I want organizations to think big, but think collaboratively, because if it's working, we want to be able to bring it to scale to where more people can benefit from a effective program.
Mhm. Yeah, that's right, Bo. And it's really admirable for government to be thinking this way. We took a big leap and we're just getting started, I think, at United Way to say that, the social sector needs R&D. We need research and development, just like the for-profit sector. Otherwise, we're continuing to do the same thing over and over again and not seeing change. And so to see the state of Tennessee embrace that and recognize that we've got to operate differently and be encouraged to do so and put resources behind it, significant resources, that's the way it's going to get done. So kudos to that. We are nearing the end of our time together. We want to check the Q&A and see if there's any unanswered questions. Abby, let's pull that back up here and take a look.
I think we've answered most of them. Let's look. Is the makeup of the advisory board evenly balanced within the geographic divisions? Do we know that?
It will be. I mean, that's kind of a political thing that those of us that live in this sphere recognize. We've got to have representation from the 3 grand divisions. We've got to have representation that balances the urban, suburban, and rural communities. We've got to have representation that addresses all of the other sort of demographics that people, we want to make this as inclusive as we can make it. When we were first developing the legislation, Representative Hawk, who represents a rural part, he's from Greenville, Tennessee, his big concern was that, the rural organizations don't get lost in the size of the project. And that, and you guys know this probably much better than I do, rural people have as many problems as the urban people do. They might be a little bit different, but they've got as many. And we learned from the CARES Act, and you guys in the Department of Human Services taught me that a lot of these are smaller counties don't have any infrastructure for doing this kind of stuff. Mm-mm. And so even if you wanted to do something in a certain county, they may not have anybody there that can deliver it. And so again, these big ideas have to include, how do we include the most people, particularly the people who have the least resources to do this kind of stuff with. So there is, obviously, we want to make sure that their voices are heard on the advisory board. So I think there'll be an effort. There's always an effort to do that.
Yeah, that actually answered the next question. So I can click that one done. Do you know, will funds come directly from DHS, or will there be a third-party administrator, both for the planning and for the bigger grants?
Yeah, that's probably a DHS question of how they want to best. They're used to distributing this money, so I would leave it to them to determine the methodology of the best way to do it. Because at the end of the day, the money will have to be accounted for, as Leslie and others on this call and I learned that sometimes the biggest problem isn't the program, but it's accounting for the methodology for accounting for how you spent the money. That's the biggest obstacle. So I would leave it to DHS to figure out the best methodology for distributing the money.
Okay, sounds like a plan. Do we know if there are any, I think this will come out from DHS, but future webinars, Q&As planned at this point?
Yeah, I think DHS will probably, as they put together their rules and their how they're going to do this, I would think they would reach out particularly to the service providers that they work with on a regular basis and make educational opportunities available.
Yeah.
I will actually, and they may be on this call, I don't know, but I will speak to them specifically to make sure that's done.
Okay, and then last question, then we'll let you go. I know you're busy. Is this a one-time thing, or are we looking at maybe doing this on a rolling basis or TBD?
The big, hairy, audacious goals is a one-time thing because we're spending down wherever I wrote that $700 million reserve. While we're spending down, what was the number, 182 million or something like that. Let's just say 200 million. You know, 200 million used to be a lot of money to me until the federal government. I just left a meeting earlier here talking about how we're going to deal with $3.725 billion. So anyway, but 200 million, you know, so once we've spent that money, it's gone. The question again, that's why the being innovative and bold and trying something really unique is so important, because we're going to get one bite at this apple. And to waste $200 or $300 million doing the same old thing we've been doing, and I don't mean that critical towards anybody who's working hard every day in their program. I just mean we have this kind of unique chance to do something really big. And maybe out of 7 bites at the apple, we get one that we can turn around and say 15 years from now, you know what, that made a huge difference for Tennesseans, and hopefully that made a huge difference for Americans, in that we created a program that actually moved people from dependence to independence in a meaningful way. And you have one group that graduates and another group will come in. So there's always going to be churn, but coming up with an idea that can change the trajectory of how we do this will be huge. And then what we would do in the future is start to fund those programs that kind of fit into that template. But no, this is a one-time bite at the apple. So I will hope that y'all will communicate to the folks you talk with every day about how important it is that they take the time to really put forth a really strong proposal.
You've got it, Senator Watson. Thank you. That's a great way to wrap this conversation. I think what we're hearing as a takeaway is we need to be bold. The time is now. That when we think about what we can do collectively, that none of us have the answers. United Way doesn't have the answer. No one on this webinar today alone has the answer. But together, across sectors, digging deep, together we just might. And so what is so exciting to us about hosting this conversation and about looking more deeply at potential next steps is that we have got a big opportunity as a community to look at data, pull partners together, dig deep about what key lever might we pull together that could just blow the lid off of some of these problems. So thank you for giving us an inside look into this. We are so thankful for your leadership, for your willingness to help us think bigger, act bigger, and be bold. Tennessee is in a great position because of the leaders that we have in our state, and also because of every single one of you who got on this call today, because you guys are the boots on the ground making this happen. So let's not be afraid to dig deeper. What's next? We're all kind of waiting, right, to understand exactly when legislation will be signed and when grants will be released and when due dates will be solidified. But I will say this: it's never too early to start digging deeply into data understanding the problems and pulling together collaborative decision-making to consider how our region could put together some planning grants to be, out of that 50, Bo, wouldn't it be great if our region had a couple of those that we could bring forward with some really high quality to the panel and to DHS. So we're going to consider what that looks like in the days to come. All right. Thank you. Thank you to everyone on this call. I'm excited for what this means for our state and the opportunity that lies ahead. Appreciate you, Abby and Jamie, Elle, and Patrick for facilitating this and getting us together. Have a great Tuesday. Bye-bye.